Hi guys, this is Vanessa Rosales, a medical technologist intern of Butuan Doctors College. This video is about my case study about Stein-Leventhal syndrome. Stein-Leventhal syndrome, also called polycystic ovary syndrome. The syndrome was first described in 1935 when American gynecologist Irving F. Stein Sr. and Michael L. Leventhal associated the presence of ovarian cyst with anovulation. For many years, these factors were used as the diagnostic criteria of the syndrome. Later, it was realized that anovulation and an elevated level of androgens, not ovarian cyst, were the more correct diagnostic criteria, since it is the combination of these factors that results from or is symptomatic of the other characteristics of the syndrome. While the cause of the syndrome remains unknown, evidence suggests that the syndrome is complex, involving multiple physiological systems. This illustration shows what a normal ovary and a polycystic ovary looks like. What is PCOS? PCOS is a syndrome rather than a disease or a group of symptoms that affects the ovaries and ovulation. Its three main features are cysts in the ovaries, high levels of male hormones, irregular or skip periods. PCOS is a condition that affects a woman's hormone levels. PCOS affects a woman's ovaries and the reproductive organs that produce estrogen and progesterone hormones that regulate the menstrual cycle. The ovaries also produce a small amount of male hormones called androgens. Follicle-stimulating hormone and luteinizing hormone controls ovulation. Follicle-stimulating hormone stimulates the ovary to produce a follicle, a sac that contains an egg, and then luteinizing hormone triggers the ovary to release a mature egg. Normally, the ovaries release eggs to be fertilized by a man's sperm. The release of an egg each month is called ovulation. In PCOS, many small fluid-filled sac grows inside the ovaries. These sacs are actually follicles, each one containing an immature egg. The eggs never mature enough to trigger ovulation. The lack of ovulation alters levels of estrogen, progesterone, FSH, and LH. Estrogen and progesterone levels are lower than usual, while androgen levels are higher than usual. Extra male hormone disrupt the menstrual cycle, so women with PCOS get fewer periods than usual. Characteristics of PCOS: menstrual irregularities, delayed menarche, oligomenorrhea, amenorrhea, and regularization after 40 years of age. Hyperandrogenism, which causes acne, hirsutism, and hair loss. What causes PCOS? Doctors don't know exactly what causes PCOS. They believe that high levels of male hormones prevent the ovaries from producing hormones and making eggs normally. If you are overweight, your chances of developing it are greater. Genes play a role too. Study shows that PCOS runs into families. Genes, insulin resistance, and inflammation have all been linked to excess androgen production. Definition of terms.
Welcome to part 2 of the PCOS series. In this video, we will discuss the pathophysiology of polycystic ovarian syndrome. PCOS is a complex metabolic disorder, which has no definitive pathway for explaining all of the internal and external symptoms associated with this condition. However, studies have revealed a general understanding behind the pathophysiology of the disorder. In a patient with PCOS, the primary defects are seen from two perspectives in the body. The first one is insulin resistance, and secondly, relative LH and FSH levels. A person with PCOS may have insulin resistance. This means that the cells within your body fail to respond to the insulin hormone to take up glucose for the use of energy. Because glucose is not being used up for energy, it results in the storage of glucose, resulting in weight gain. Ultimately, the excess insulin within the body will cause the ovaries to increase production of androgen. This can lead to anovulation. Furthermore, the two main pituitary hormones that orchestrate major changes in your body are luteinizing hormone, LH, and follicle-stimulating hormone, FSH. These are hormones essential for reproduction. LH stimulates the production of androgen substrates, which are converted to create sex hormones such as testosterone and estrogen. FSH stimulates the growth of the ovarian follicles to allow maturation of the egg before it releases. It is important for FSH and LH to be in precise balance to avoid complications. Normally, during the beginning of the menstruation cycle, FSH is higher than LH. However, in PCOS, this is reversed. Initially, instead of a higher FSH, there is an increased level of LH, which produces an excess of androgen substrates that lead to elevated testosterone levels, which are associated with the excess body and facial hair. Furthermore, with the decreased levels of FSH, the ovaries are not stimulated adequately for maturation and eventually ovulation. This is the reason why women with PCOS have difficulty conceiving and experience irregular menstruation cycles. This is a simplified version of the mechanisms behind a few of the symptoms associated with PCOS, and further research is still being conducted.
Epidemiology. World Health Organization estimates that PCOS has affected 116 million women worldwide in 2012. Globally, prevalence estimates of PCOS are highly variable, ranging from 2.2% to as high as 26%. Signs and symptoms. When you have PCOS, you may be experiencing several seemingly random unrelated symptoms. PCOS affects your hormones dramatically, so you may experience these symptoms. Hair loss from your scalp and hair growth or hirsutism in unexpected places. Oily skin and acne problems. Infertility or repeat miscarriages. Weight gain, especially around your waist. Menstrual problems. Depression or mood swings. Diagnostic workup. The Royal College of Obstetricians and Gynecologists recommends the following baseline screening tests for women with suspected polycystic ovarian syndrome. Thyroid function tests, serum prolactin levels, and a free androgen index. Treatment. Even with no cure, you have the power to ease the symptoms of PCOS. There are certain lifestyle changes and treatments you can undergo to relieve your symptoms. Incorporate good nutrition and regular physical activity. By losing weight, you'll help your body improve your hormone levels. Even losing 10% of your body weight can make a difference in your menstrual period and ovulation. Your doctor might prescribe medication to help manage the symptoms of PCOS. These medications might include metformin. This medication improves your body's ability to lower blood sugar, insulin, and androgen levels. Metformin can help restart your ovulation and may help you lose weight and improve cholesterol levels. Hormonal birth control. If you don't want to get pregnant, birth control can help regulate your menstrual cycle, lower your risk of endometrial cancer, improve acne, and reduce extrafacial hair. Anti-androgen medicines. Because anti-androgen medicine reduce androgens in your system, they can reduce hair loss on your scalp, reduce facial and body hair growth, and improve acne. Don't take this medication during pregnancy. And that ends the discussion of my case study about Stein-Leventhal syndrome.